Okay, so after I was diagnosed, after we had determined that definitely something needed to be done about the brain mets. At this point, I believe, we thought there was two. And again, these are very small. I was, becoming very familiar with uh, what it meant to have these tiny brain mets. I mean, the tip of a pen, and I couldn't even understand how anything could be seen that small. However, it's, no symptoms. I would never have known that this was there. Um, but it was definitely something that we had to address. I was in between, prior to this finding, I was in between chemo and radiation, and the radiation was supposed to be this other really major piece of the puzzle that was going to, help save my life. And at this point, yes, we found these brain mets. I was still very much holding on to the idea that I was going to be cured. And yes, I knew that we found the brain mets, but I was also believing that maybe this was just a total fluke, like it was just going to be a couple spots. We're going to move on. There's no disease in my body. My bones were clear. I felt so healthy. I was really holding on to what was supposed to happen. And what was supposed to happen was that I was going to have chemo and then I was going to have radiation. So at this time, there was a lot of back and forth as to whether I was still a candidate for chest wall radiation, given the fact of the, brain mets finding. And I really wanted to push for radiation, for chest wall radiation. I wanted to complete what in my mind was this full picture of how I'm going to beat breast cancer. And I had found in my providers here, my radiation oncologist, who was supposed to be my chest wall radiation oncologist, as well as in my second opinion, where I flew to Boston. I went to Dana Farber and saw Dr. Nancy Lynn, and she also agreed that chest wall radiation may be appropriate if the disease to the brain stays limited to this two spots. So I felt really reassured by this. And so I went back to Seattle, and it was decided that if the next brain MRI comes up and there's nothing new happening, and at this point I had started letrozole and I had started getting Lupron injections. And the plan was to start Verzenio. But I think for the fact that we knew I was going to I was going to have stereotactic radiosurgery and potentially chest wall radiation, the starting date of when to start the Verzenio was a little bit in flux. And it was, there was a lot of back and forth, and that period of my life gets kind of fuzzy on why exactly we were pausing. And I was doing a lot of research on trying to be able to start Verzenio and push for chest wall radiation. Chest wall radiation was going to be every day for, I don't even know how many weeks, a lot of weeks. And that the thought was, most of the research and all the doctors were saying, you can't be on Verzenio as you're getting chest wall radiation. And I was trying to prove them wrong that you could. And I did in fact find some studies, but by and large, nobody wanted to do that. So when the next brain MRI was done, it really closed the door on chest wall radiation because another couple spots were found. And so at this point, there were 5, and these were still all very small, asymptomatic, but it was kind of moving out of that ogliometastatic. I mean, it was still 5 spots, and I was really holding on to these definitions, and I'd find different definitions of ogliometastatic and blah, blah, blah. I still qualify. It's still what it is. But ultimately, we were moving. My providers were getting more and more convinced that we needed to focus on the brain and not chest wall radiation.